Okay, call this meeting to order. And are you going to run the roll call?
All right, for roll call, Sheriff Youngblood,
Sorry, we were having a meeting.
John Surface,
Here.
Dr. Lyon,
Here.
Chief Albertson,
Here.
Dr. Franklin,
Right here.
Orchel Crier,
Here.
Scott Hurlbert.
Here.
We have a quorum.
Mr. Surface will lead the flag salute. Consent agenda. All items listed with the CA are considered by program staff to be routine and non-controversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda and will be considered in listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. Do we have any public presentations? No? Board member announcements? Do you want a motion to, on consent? Sorry. Do you have a motion for the consent?
Yes.
So moved.
Second.
You doing a roll call or no?
Yes.
Sheriff Youngblood,
Yes.
John Surface,
Yes.
Dr. Lyon,
Yes.
Chairman Flores,
Yes.
Chief Albertson,
Yes.
Dr. Franklin,
Yes.
Orchel Crier,
Yes.
Scott Hurlbert.
Yes.
Motion passes.
Thank you. Sorry for getting out of order. So we already did the public presentations and board member announcements or reports. There are none, it appears. So we're moving to the manager's report. Mr. Ferris?
Before Denver Sheriff was here, he is my alternate now on the board approved it. The last one that I picked in the last week, so
Lasts longer than that, Larry.
hopefully lasts longer than a week, Sheriff.
Not as much as I hope it.
Okay. Thank you, sir. Call volume continues to create challenges for our system. Total EMS calls received and responded to as of the end of October 2025 is 117,603. This represents a 1.18% increase from last year. The current projections for 2025 are pointing to an all-time high of over 143,000 calls. Ambulance response time compliance, however, is improving. Hall ambulance service for priority 1s and 2s is 96.20%, and Liberty ambulance service is 97.95% for the first, second, and third quarters of 2025. Kern fire agencies, all combined, are maintaining an average of about a 10.20-minute response time to those lights and sirens calls. Ambulance availability and staffing levels continue to improve as well. At our last meeting, we discussed the training programs throughout the county and continued to push to produce EMTs and paramedics. Recently, Hall Ambulance Service reported that they had surpassed 500 employees, which is an all-time high. Liberty Ambulance Service is has reported that they are currently looking to fill 3 paramedic positions that have been vacated. However, they have been maintaining a full schedule. Saracoso College recently submitted a request to begin a hybrid EMT program, which would enable them to reach students in Inyo and Mono counties as well. And recently, EMS started providing students in our local education programs with access to our patient care reporting software, ImageTrend. This allows students to practice writing actual patient care reports, just as they will be in the field, but in the classroom setting where they can be supervised and guided. We hope that this initiative will help them make a transition a little bit easier and improve the quality of data we receive and forward to the state and the National Emergency Medical Services information systems. In the first 3 quarters of 2025, the EMS certification team completed 745 California EMT renewal certifications and 107 new California EMT certifications for a total of 852. Local accreditation applications totals for the county are 119 newly accredited EMTs, 13 emergency medical dispatch accreditations, 114 paramedics, and 55 mobile intensive care nurses, new or maintained accreditations. Altogether totaling 1,153 renewed, newly certified, or accredited applicants. Policies, procedures, and protocols continue to be reviewed and updated. EMS is currently or has recently updated the ambulance service performance standards, emergency medical dispatch policy, telehealth policy, the EMS quality improvement program, as well as the EMS plan, just to name a few. Our field crews have made contact with telehealth physicians 4,578 times this year. This represents a 132% increase from the same time last year. For those contacts, 78% resulted in no ambulance transport. Again, while these numbers and percentages are very promising, they only represent roughly 3% of the total call volume. EMS is still actively searching for ways to reduce unnecessary transport to already impacted hospitals. EMS has received the 100 Cardia 12 lead devices that this board approved. Training for these devices is scheduled for the first part of December, and we are hopeful to have all crew members trained by January 1st. Our emergency preparedness team, which includes our Region 5 Regional Disaster Medical Health Specialists, have been extremely busy working with Region 5 counties to monitor the current infant formula botulism issue. Our EP team has secured the new FEP and HPP grant budgets, as well as scheduled a new set of drills, exercises, and training classes for the 25-26 year. Yesterday, our EP team hosted the Healthcare Coalition meeting, during which they conducted an active shooter tabletop exercise that included over 50 members of the Healthcare Coalition, the Emergency Operations Center, and the EMS DOC. Additionally, our EP team continues to work with the County Emergency Operations Center as it transitions to a Type 3 credentialed center. And finally, we continue to reach out and partner with the community with EMS, hands-only CPR, Stop the Bleed, Water Watchers, and Narcan administration. Our commitment to providing exceptional emergency medical services remains unwavering. As we continue to face evolving challenges, our focus on training, resource management, patient care, and community collaboration will ensure that our crews maintain and deliver the highest level of care. Together, public health, EMS, this board, and our providers will continue to work to strengthen our system and safeguard the health and safety of the communities that we serve. That concludes my report, and I'm available to answer any questions.
Thank you, Mr. Ferris. Is there any discussion from the board? Sir?
So Jeff and I talk a lot about numbers, and back during the pandemic, we were working really hard to staff 60 ambulances a day. And I sent Jeff a text Monday night, letting him know that Tuesday was a record-breaking day. We had 81 ambulances in the system on Tuesday. And that training, we've opened up pipelines with all the colleges to bring folks in. And we have right now 51 people in field training, and 15 more start Tuesday into that field training. So we're growing and the call volume is growing, and we're trying to grow with it. And to that end, we even had to order 16 more ambulances to be able to have enough vehicles to put on the road, because at night we're running a little low of equipment to turn things around. So Jeff gets on the telephone with Myron and I. He and George once a week, and we talk about the system, and we've collaborated and had to be poked a few times, and we've had to poke back a couple times, but we're making pretty good success. So thanks for your partnership.
Yeah, absolutely, thank you. And it's been a long time since we've heard anybody say that they have more staff than they have equipment. So that's a very good sign.
Thank you. Any further discussion or comments? Take a motion to receive and file.
Move to receive and file.
Second? All in favor, say aye. Any opposed? Motion carries. Ms. Kerrigan, will you be doing the APOT Task Force report? Thank you.
All right. Good afternoon, everybody. My name is Bryn Kerrigan, Director of Kern County Public Health. As your board will recall, late last year, I met with the hospital CEOs to request their participation in an APOT task force focused on developing a collaborative system-wide improvement to address offload delays in Kern County. The CEOs opted to designate representatives to participate in the task force on their behalf. The task force met monthly and identified 5 key contributing factors believed to be driving APOT delays. Building on that foundation, the group developed a set of practical objectives aimed at addressing these contributing factors and improving ambulance patient offload times. At the last MCAB meeting, I presented the resulting Kern County APOT strategic plan. Shortly afterwards, I met with the hospital CEOs to share the same plan and requested their feedback within a following couple of weeks after that presentation. While we did not receive strong buy-in from the CEOs, we do believe the thoughtful work completed to date does have promise, and we remain confident that some progress is achievable within this plan. The task force will continue to meet regularly and advance the strategies outlined in the plan, but recognize that further action will likely be needed in order to fully address this issue. Dr. Lyon and members of the MCAB board, that completes my presentation, but I'm available for any questions you may have.
Thank you for your report. Are there any questions or comments from the board? No. Accept a motion to receive and file, please.
Motion to receive second.
All in favor, say aye. Any opposed? Motion carries. Excellent. So we are now to adjournment. The deadline for submitting public requests for the next MCAB meeting is Thursday, January 29th, 2026 at 5 p.m. to the EMS program manager. And we'll adjourn to Thursday, February 12th, 2026 at 4 p.m. at the Kern County Administrative Center. Do I have a motion to adjourn?
Motion to adjourn.
Thank you, everyone.